Now, I used the term leapfrog in my talk. So why would you want to leapfrog over what the regions have accomplished? Why would you want to do better? Well, frankly, it's because the regionalization had a lot of promise. And I think it would be widely agreed by people, particularly in regional health authorities. And some years ago, colleagues and I surveyed regional health authority boards and senior managers across the country. I think they would say that some of the dream has not been realized. One of them, which is a feature of Canadian health reform in general, has been an inability to move some important agendas forward. The other big issue is quality and safety. There's the Baker-Norton report, which of course originated here at the U of T. By and large, we are trying a lot harder. Quality and safety are certainly on the agenda, but again, I don't think the data yet support the proposition that we have made a great leap forward there. There is still a lot of provider skepticism about restructuring and about systems. Providers are still essentially educated in isolation. Professionals still see themselves as operating within a particular domain, and it's just not a feature of most professional and clinical life in Canada that you practice as part of a system. It's improving, but it's slow. There are lingering and divided loyalties and unconstructive competition among organizations, even within health regions. I don't think this is going to shock you, but that's a reality. People do have divided loyalties. Some of that's a very good thing. Some of it is not. And figuring out which is good and which is not is difficult, and making sure you get one and not the other is even more difficult. Regionalization has been buffeted about by quite frequent restructuring. I mentioned the regional boundaries changing very frequently. People are here from CIHI. The Change Foundation strategic plan addresses it. We don't measure very much and very well in Canada in real-time terms. We don't really know how well we're doing, and when we don't know how well we're doing in a comprehensive way, opinions carry the day, and so do historical traditions, and so do vested interests. So if you don't have very high-quality real-time performance data that can justify a move, a resource allocation, a resource reallocation decision, you tend to get a clash of interests, and that can be all right in some cases and be unconstructive in others. And unclear lines of authority. Again, I mentioned the government devolution being uncertain. It's created a lot of confusion in the regions.